views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening. Welcome to Bronx Talk. As the pandemic unfolded, the Bronx numbers looked pretty encouraging compared to other boroughs. But as time has gone on, unfortunately, Bronx numbers have gotten worse. And in fact, to this point, half of Bronxites who have tested for the coronavirus have tested positive. And the Bronx, unfortunately, leads in a mortality rate of all of the other boroughs. And so this evening, we thought we'd bring in some community advocates and as well as a Department of Health expert to address some of the numbers, see where we're at currently, and then hopefully also take a look at the future and what we might do to improve things in the Bronx, both short-term and long-term. So let me introduce our guests to us. The first guest works at Advancing Health Equity among New York City's families and children. He is the Deputy Commissioner of the Division of Family and Child Health at the City Department of Health and Mental Hygiene. Folks in the Bronx would want to know that he worked at Children's Aid Society, also was the Director of Adolescent Medicine at Union Community Health Center in the Bronx. Dr. Daniel Stevens, thanks for taking the time to join us.
Thank you for having me to talk about these important issues.
Yep, and we know that you and your colleagues are very busy. We're all busy now, but we really do appreciate you taking a moment. Also, a founding member of South Bronx Unite and an advocate for environmental justice in the Bronx for many years, Mychal Johnson. Nice to have you with us, sir.
Thank you, Gary. Pleasure to be here.
And the Democratic District Leader and Municipal Services Chair for Community Board 10. It is Marjorie Velasquez. Nice to have you with us, Ms. Velasquez.
Thanks for having me.
Dr. Stevens, let's start with you. I laid it out in broad terms that originally, and I remember when the mayor would read the statistics of those infected, et cetera, the Bronx was consistently at the lower end, and I was like, well, that's good. My suspicion, given our longstanding epidemics in asthma, diabetes, obesity, and difficulties with drug addiction, said, this probably isn't going to last, and unfortunately it didn't. So give us a bit of an overview of what you and the department is thinking about when it comes to the borough of the Bronx.
Sure. I think, as you pointed out, when what we know is what we know in the moment, and what we have is the best information we have up to date. And sorry about that. And so initially, while the numbers did look, as you were saying, as we move forward in the pandemic and tested and increased testing and saw the effects as they hit the community, as you were saying, unfortunately, it was not a surprise to see the numbers develop as they have in the Bronx. And so now we have over 2,200 cases. Again, these numbers update almost every few hours. And so even the numbers I had from the first thing this morning may not be up to date. But as you were pointing out, 22% of the, there are the rates of laboratory confirmed cases in the Bronx are higher, as we're seeing. And particularly in the Bronx, we're seeing a higher rate amongst Black and Brown people in everything from lab confirmed cases, non-fatal hospitalizations, known fatalities. And while we're trying to, always improve and get more data, the data that we're seeing is very concerning.
No question about it. From a community health point of view, knowing these things, I suppose there are people who are saying, well, wait a minute, the city could have or should have anticipated this sort of thing. Give me an idea of, and again, listen, I'm not taking anything away from any other borough, and we all deserve care and treatment and support. But what is the Department of Health's vision of the Bronx, and in terms of targeting some of these real hotspots, which we will review with our other panelists today? What is it that the city is thinking about doing?
Sure. So I think there are a couple of things just following up to what the city is doing in the Bronx, specifically targeted to this particular disease outbreak, and that's layered on top of some work that's already been going on in the Bronx for a while. But the city's 4-point action plan is to really kind of support public health care in the Bronx. And so public hospitals are the front line. Many of the most under-resourced communities, Black and brown and poor individuals, experience and access the public hospitals. We have added thousands of personnel, both military and folks from around the country, trying to support the surge of need for staffing and these hospitals, providing PPE or personal protective equipment. The city is actually manufacturing PPE. We're opening community test sites in all 5 boroughs, including 3 at NYCHA developments in the Bronx at Edenwald, Highbridge, and Andrew Jackson houses. We're really trying to, the second thing we're trying to do is a targeted public awareness campaign, right? We from the beginning of the outbreak, you saw messages of good public health, washing your hands, trying to practice social distancing, all of those things. But now we're at a point where we're trying to target those messages and others at the hardest hit communities, like the Bronx. And those are in 15 languages with a grassroots a grassroots approach to outreach as well. And we're trying in every possible way to lean on trusted community members using teletown halls, webinars, really trying to listen to where the need is and try to reach out and reach the communities most affected. So far, 1.1 million New Yorkers have been reached by robocalls, and 24 different languages the messages have been disseminated in 24 different languages on social media. And then the last thing I'll mention, and the mayor mentioned this morning, around telemedicine and really our efforts to ramp up both the capacity and access to telemedicine, and expect more information about that to come out soon, as the mayor mentioned. But it's important to kind of mention that as an aspect. And those are targeted efforts on top of the Department of Health has had a Bronx bureau office in the Tremont area for over 17 years. And that team and that office has been in the community working on issues ranging from asthma, food access and nutrition. Health Bucks kind of came from that area. Sexual reproductive health, the Bronx Teens Connection, which is now the New York City Teens Connection. There's been a lot of work that has happened in the Bronx. But as you said, these structural inequities that we're seeing are magnified and intensified. People say that the virus doesn't discriminate, but what it does is it exacerbates inequities that have been here for a while, and it makes it more deadly and lethal and severe.
I'm going to, we'll bring in our guests. I'm going to, in a moment, our other guests, I'm going to ask you one more question. I'm not one of those. There is a chorus out there that says both the mayor and governor were too late. And had they acted 2 weeks earlier, we would have been better off. I believe that they are responsible for assessing what they see in front of them in their city and their state. And the advance notice was, the dereliction really should have come from the president and the national office. It's another issue that's, we're not going to be able to deal with on this program, but that's my perspective. On the other hand, given now we know that there's something coming to the city of New York, couldn't the Bronx have been? Well, I realized it centered in Queens to start, and we know what happened at Elmhurst Hospital. But maybe the Bronx should have received a little more attention before this, as opposed to saying, well, now that we see what the numbers are, after the fact, we're now saying, okay, let's create these things. So just what's your perspective on the timing? And then we'll bring in both Mr. Johnson and Ms. Velasquez.
Sure. I think you raise an important point, and it ties to a broader issue of structural racism and inequity in our system, right? Who do we pay close attention to? What should our work be looking forward as far as our focus, our attention? Where should we monitor? What resources do we put in? And so, I liken so I'm a pediatrician by background, right? And I remember in medical school when we were learning about different diseases, as you mentioned, all these epidemics that show up in the Bronx, diabetes, asthma, we would always hear time and time again, Black individuals, Black community, brown folks are more susceptible to these diseases. And it's really, I just want to be very clear, it's racism, not race, that predisposes people to horrible health outcomes, right? And I always say, in the 1940s and 50s, people at first correlated smoking to coffee because people would go on coffee breaks and they noticed that those people had higher rates of lung cancer, right? But what they found, right, that was a correlation. But when they looked at what people were doing on those coffee breaks, of course, in the 40s and 50s, people were smoking. So when it came to causality, we found that it was actually smoking. So similarly, when we look at the disease burden and disease prevalence, and we're finding these terrible statistics, and we see Black, brown, poor communities, oftentimes we say, well, race is tied here, but it's racism. Let's be clear about the kind of the root causes that we're finding. So I would just say that you raise a good point. I think we should be focused on the Bronx and other communities that have overrepresentation of under-resourced individuals through COVID and beyond.
I think I couldn't have had a better introduction to my friend Mychal Johnson than that. Mychal has been fighting environmental justice in the southernmost part of the borough for a long time. Mychal, without going through what you've done in the past and what your issues have been in the past, bring it up to date. What do you see now in the South Bronx and as regards this virus? Where are we at and what do we need?
Well, I think we're at Dr. Stevens, thanks so much for what you just your talk right there. I mean, it really hit home on a lot of levels what we're dealing with. I think we do have to also see the past and how that built what the future and what's present, and how we can go forward is how we have what happened before this, and how we don't keep reinventing the wheel, doing the same thing over and over again and expecting different results. So what we're dealing with now is the direct symptoms from a system that has really made this community its dumping ground for industrialization, heavy concentrations of highways encircling the neighborhood, where we see our people living in these NYCHA developments, some of which aren't making it to the hospital. Most 95% aren't being tested. And prior to the opening of Belvis and some other sites being as pilot projects for testing, they had to drive to Co-op City. And if you don't have a car, you don't get tested without an appointment. So there's been too many staggered roadblocks and almost like an obstacle course of getting treatment. We're getting too many. What's happening on the ground is people are dying in their apartments. People are sick without actually knowing what they can do next. Their primary care physician has always been the emergency room. So you don't have the situation, and even though the health industry is the largest employer in the Bronx, because of the high rates of asthma, obesity, diabetes. But what is the cause of that? How can we stop the cause so these types of things don't keep reoccurring? I mean, it's not going to be the last time we have a situation where it's a dire health consequences. We've been dealing with these health consequences all the time. We have high rates of infant mortality. We have teenagers and people in our community dying from asthma, but not immediately, but over long periods of time. So people don't see it and see their need to come racing because there's a fire burning here. And there's been a fire burning in our communities for a long time.
The immediate response, I think, would be, well, we need to ramp up testing. We know and I know that the state is going to be has brought on Michael Bloomberg to do tracing and all those kinds of things. But on the immediate level, you need those things. I don't believe those resources are there. I mean, nobody could disagree with you at this point and say we need more testing. And I guess some of what you're saying is a long-term perspective and say, well, what have we learned from this? Is there anything other than just bringing more testing and, getting more health professionals in the neighborhood that can work at this point? Do you think people are socially distant? They understand the nature of what we're dealing with and at least have a point of view about what helps them protect themselves?
Socially distancing is an economic, privilege, right? If you have the ability to afford to stay home, Most people in our communities, which living in the poorest congressional district in the United States, don't have that ability to order their groceries while they're sitting at their door in their homes. They have to get out, go to the house, go to the grocery stores, and be in contact with people with no social distancing or physical distancing, I would say, because we need social connection throughout this. The elevators in these buildings don't work half the time. Their elevators themselves are 5 foot by 5 foot. How do you separate folks from that and not be so close in confines? I think testing is the only way immediately to actually know where people are and how we can best address those who are affected and make sure we can protect those who are not. Mobile testing sites is something we've been advocating for. Like, come out to the developments where people live. Do the testing right there, especially in NYCHA housing. Where's the screening? Where's the knocking on doors? These are things that people don't have real questions. A lot of people don't have internet. So if you can't go knock on their door, they have a cell phone. So that means their cell phone is not listed anywhere, the number, so they can't be called. So we really need a real conscious effort of coming out to where people are and making sure this society will survive. It's historically left behind. This is the point right now today. We can't continue to leave these people behind because they're dying at much more higher rates than who are infected anywhere else in the 5 boroughs.
I made a list of factors that have came up in a number of articles and a number of studies about what really has caused people of color to be at greater risk. Access to healthcare, the high risk factors that we talked about, the diseases of asthma and obesity and diabetes and drug addiction. Poverty probably should lead the list. Lack of health education, air pollution, lack of access, of course, to fresh food, lack of green space, people living in crowded apartments at homes, stress factors, some of which Mr. Johnson has already addressed, that decrease immunity, disparities, of course, in available resources like testing and things like that. I'm only listing them so you don't have to. I think
right, but there's one you missed: lack of fresh air. Right?
Fresh air. Yeah, I said green space, but okay.
Right. But when we look at this community, has been the shouldering the burden for industrial sites. I mean, the largest significant maritime industrial area lining our waterfront from here through Hunts Point, right? By no design, by no ability for people here to say no, it was from the top down, putting our community. I mean, the current governor put Fresh Direct here with 1,000 more diesel truck trips coming through this community without relying on a current environmental impact statement. His father brought in leased the Harlem River Yard to Gillespie Group for 99 years, which brought in waste transfer stations, fossil fuel power plants, New York Post, Wall Street Journal, all these heavy intensive businesses. So I'm preaching to the choir, but I just have to make sure we say these things because the people in our community think it may be because of who they are and are they susceptible because they're Black or a person of color. No, they're suffering because of top-down decision-making that's actually made the built environment what it is, and that's why they're themselves are more susceptible to this.
I want to bring Marjorie Velasquez, who's been waiting patiently to join us as well. Now, I talked, Ms. Velasquez, I talked to someone in the South Bronx who said he had gone, when this started, he had gone into some NYCHA buildings, and he was shocked to find people weren't aware of what was going on. They had kind of heard about it on TV. You have spent a lot of time helping to pick up medicine supplies and groceries for some of the people that Mr. Johnson was just talking about. You've gone to local hospitals and provided lunch and dinner for people, working with small businesses. Tell me, when you go face to face or when you knock on people's doors, what are you finding, especially in some of the NYCHA developments?
It's been so first of all, thank you to Dr. Daniel, and definitely thank you, Mychal. What we're seeing right now is definitely what has been a decade's buildup of how our communities have been ignored. We are an out of borough and out of sight, out of mind. And it is what we have seen. And it is due to lack of proper transportation for our communities. It is due to lack of access of fresh foods. It is a lot of these things that have been compounded. And right now, it's a release, right? Like now it's just wide open, and now the world sees it, and the Bronx is suffering. And what we're doing together, though, what we're seeing is a momentum within our communities to build each other up. Because what the Bronx has never lacked is a community. And we've learned early on that we need to support one another. And so it has been through a mutual aid thread, right? So what is that? It's what I have been working alongside lots of electeds like Senator Biaggi and Congresswoman Ocasio-Cortez is checking in on our neighbors, checking in on our most vulnerable folks and saying, hey, how are you doing? Do you need help? And so sure enough, last week I was at Throsneck Houses here, which is a NYCHA development, and we were able to give out, personally, I did around 60. In total, it was over 100 meals. And what you see firsthand is there is a need. We're also seeing folks who just don't have the economic ability, right? Because price gouging does exist. And so folks really need to take that seriously. And if you do see someone, you go to a grocery store, you go to a store and you see that, if you do find Lysol wipes and now all of a sudden they're like $20 a shot, please call 311, please notify. Also, what we're looking at is hand sanitizer, Clorox. Those items are crucial for our communities, and we're looking at folks who will want to take advantage of our communities. We're not about that, and we got to stand close together as a community and call folks out. Next thing, if you are mobile and you do not have COVID, please, 1 hour of your day, help out, right? I have a mutual aid group, but there are others within the district, and we all talk. So if you are willing and able to go out and spend a day just delivering, you have your mask, you have your gloves, or if you need that, we can help provide that. Just help deliver. Also help make phone calls. Call your local neighbor. We're here. I think that's the number one thing that folks need to understand. You're not alone.
So I think we can all agree with what you're saying and what you have laid out. And I'm going to go back around the table to Dr. Stevens. Now let's talk about the future. One of the things that I want to envision, especially for the borough of the Bronx and the South Bronx in particular, and some of our neediest folks in particular, is what do we do from here? And what do you think the Department of Health has learned from this that you can say, well, now we know this, and how are we going to apply it?
A number of things have come up that we've learned from the immediate crisis, right? We are going to continue to prioritize the Bronx. We want to focus on grassroots efforts and bolster community efforts, because partnering with community, we can get messages heard in ways that we never can. So really, how do we get information out to people who most need it, from a communication, from a health promotion standpoint? But also, I think the department has had an equity agenda and an equity lens for a while now. What we're seeing, and Marjorie highlighted this in her comments, is the need to mobilize that, to move it forward. And so I think equity, we need to continue to center it, but we need to take that into everything we do, whether it be health promotion, partnerships, and how we invest and promote health moving forward. So I'll stop there.
Okay, so I think we will all agree with that. I liked a couple of things that Ms. Velasquez said, Mychal, and that is, number one, re-emphasizing the things that you have been talking about, and maybe reinvesting. Also, I think we're all learning a little bit about, maybe we don't need all the stuff that we have had in the past. And so just for your concluding remarks, Mychal Johnson, what do you recommend from a general point of view, as an education from this very difficult experience?
I think going forward, I think we have to really look at communities like frontline communities that are especially designated environmental justice communities. How we do development in these communities have to have higher scrutiny, higher levels of scrutiny. I mean, Robert Moses created Cross Bronx, and it kept going from there. We never learned, and we need to go forward by learning from the mistakes of the past. That's not really benefiting humanity, is benefiting profit over people. And we have to make sure how we go forward has got to be a holistic health approach to development that really encourages and bring forth the voice of the people who live in these communities. Because I think they have the answers, but they've been left out. And so those who are most affected have the answers. They need to be engaged, and they need to be involved in decision makings about how their communities are being developed or built out. So how we move forward on developing it out, what do we build, what are we servicing, who is it benefiting? I mean, you can't say economic development and it does never trickle down to the community you're building it in, right? You can't, and all it does is it gives us the fumes from the trucks. So we have to look at these things a little bit more serious in terms of what development looks like and who's it for.
Marjorie Velasquez, let's get to you and get your final word as far as what you were talking about of people working together and the energy in the borough of the Bronx. I really take that to heart. Maybe we could talk about people getting a kind of a greater social conscience at this point as a result of what we're all going through now.
Right now, the Bronx is building each other up. It's on us. It's really on us to build each other up. And what it is join your mutual aid groups if you can. Check on your neighbors. Make sure that you take 2 minutes of your day at 7 o'clock and thank our essential workers.
Mm-hmm.
Not just
I think
today, but tomorrow and in the future. We'll never forget. And third of all, give your small businesses a shot. If you have a restaurant, try to shop for them once a week. Try to make sure that you keep tabs on your local business. If they're not open, see how you can support. If they have an online store, purchase a gift certificate for the future.
Makes a lot of sense. I do want to thank all three of you for joining us. Dr. Daniel Stevens, thanks for doing the great work. He is one of our first responders, and we thank you for your great service. Mychal Johnson, for your ongoing passion about your neighborhood and our communities. And same for you in a different part of the Bronx in Community Board 10. Marjorie Velasquez, thank you, all three of you, for joining us. Folks, we'll be back next week. Next week, we will have a stirring show, not only about small businesses, but businesses and budgets in general. Our guest will be the controller of the city of New York, Scott Stringle, will join us. So that's it. We'll see you next week. And thanks to our guests again. Please stay safe. Thank our first responders, and we'll see you next week. Goodbye.